somebody will appreciate it. And these are not going to go in your camisole. So what you're going to need to do is get fitted for a new bra. And they're mastectomy bras, actually. They're special bras that you would have to go not the drugstore, but you'd have to go to a medical supply place to get them. Cause I've checked around different places, you know, malls and stuff like that. They don't really carry them, so you have to go to medical supply place to get them. And once you put it on, they look pretty much like regular bras. Like, this is a white one, which I should not have gotten white the first time, because when I went to have radiation, you get all marked up and with ink and everything, and then you go to put your bra back on, and then you get ink all over your bra, and it does not come out. So I have blue ink all over this, but anyway, for the purpose. The inside of these bras are pocketed. Let's see, right here. There's a pocket. It opens up, and you slide the fake boob in here. So I'll show you. You open up the pocket. You decide what way you want to wear your boob, if you want to wear it up and down or to the side or whatever. The rounded side pointed out, and then you just plop it in. Put it on same way you would a normal bra, or get some help if you know. And then this is how it looks once it's inside your bra. It'll be a lot firmer. So once if it's on your body, it won't just be hanging like this. But then you'll have to and normally they'll help you if you already have your prosthesis and everything. When you go in the health store, they'll take you. They usually have some private rooms for measuring and everything like that, and they'll help you adjust it so that this side looks like this side, so it won't be like, you know, because this boob ain't so firm anymore, and then this boob is just sitting up all nice because it's not as much weight. So they'll help you. They'll help you do that, and they do come in black and beige also. I tend to go towards the black now because I wear darker colors. So I go towards black, and it's not a whole lot of choices as for cute bras. Like, yeah, I know women like to wear cute bras, but it's just not a whole lot of choices. You don't get to get pink and blue and flowers and all kinds of lace everywhere, and it's no more push-up bras, ladies. So there's nothing to push up, so you don't get to show the ladies off anymore. But anyway, another thing you might want to think about is if you have to have chemo after you have your surgery and everything, you're going to want to get a couple scarves. In the beginning, you're not going to want to wear a wig, because if you were like me, you're going to be really hot and frustrated, and this is going to be your best friend. Some women, they don't mind going out bald, but I did. I didn't want anybody to see my bald head, so I just get a really soft scarf, and sometimes they have these people donate in the oncology center, and they have a room for it. They have scarves and hats and wigs and, you know, anything. So you should ask. You should ask, and you just wrap your scarf around your head or whatever, like an old lady, or tie it and try to make it look as cute as you can. You can get different colors, it doesn't matter. But you will eventually, if you don't want to keep wearing scarves, or if it's colder, you want to look cute when you go somewhere, then you're going to have to think about getting a wig. And this is actually my first wig. It was very straight, to the point wig. I covered my head up. It was cute. I can take pictures in it, and it's synthetic. It's not hard to take care of. You can wash it and brush it out and dry it, and it'll be ready to go. So, you know, don't get something that you're going to have to work really hard on, because you're already going to be tired and sick and everything, so you got too much going on to be worrying about your wig all the time. So try to keep it simple. And another thing, if you actually get have your lymph nodes removed like I did, you could develop lymphedema, and it's just swelling in your arm or other parts of the body. It could be in your chest or lower abdomen or the back or anything like that. But if you do end up getting lymphedema, you'll end up getting a compression sleeve like this, and they are very tight, and when you first get them, they are really aggravating. You have to figure out how you're going to get it on, because you have to do it, yourself, really. Your therapist will help you get it on the first time when you go and have lymphedema therapy done, if you have that. And it's very important to try to catch that early, because it can get out of control, and there'll be a lot more stuff you have to deal with. But this one actually, at the top, it has, if you can see, it has little silicone knots here on the top. These are on the inside of the sleeve itself, and it helps to hold the sleeve on. When you slide it up your arm, it won't roll back down. But if you don't have that on the inside, you can get some glue. It's glue that you can put around the inside, and it'll hold it up. It's supposed to, but I think the silicone works better. But I don't really like the fit of this glove, but the silicone works better. And then I was saying, has rubber on the inside. Anyway. And then if you're like me and you get the swelling in your hand, then you'll need a gauntlet, which is just a glove with no finger holes. It's like a cut-off mitten. That's what it reminds me of, a mitten just cut off. And it's nice and tight, so it helps to keep the fluid flowing nicely through the arm area and around the way it's supposed to be. And you'll just do whatever your doctor or the specialist or your therapist, whatever they say is best, and that's what you'll do. And you'd probably just need maybe a broomstick. I know that sounds crazy, but a broomstick to add some weight when you're doing, because after you finish with have your mastectomy, you'll have to do some exercises to kind of build the strength back up in your arms, because you don't want to baby your arm, because you don't want to get your arm stuck like this. And I was babying mine at first, but now I have pretty good range of motion. See, I can't lift it totally over my head like this. I can't do this with this arm, but I can kind of do this. But you don't want to baby it too much, because it'll be tight and your muscles will get all tense and everything. So you'll have your broomstick to do your exercises and different things, that whatever they tell you to do. So basically that's all. There's nothing else. You'll have your bandages and everything. You won't have to get new ones. They'll bandage you up. You'll keep them until it's time for them to come off. So that's it. You'll need to make sure you have lotion. If you do end up wearing one of these sleeves, you have to make sure you have lotion so you can keep your arm moist and everything, because you don't want to get any infections or whatever in your arm. But I'll talk about that later. But pretty much that's it. Just try to keep yourself safe and informed, and make sure you go to the dentist, because you don't want your teeth to fall out while you're having chemo. So, just take really good care of yourself and make sure you have all the things you need. Your doctor might say you need some other stuff, but But as far as me and stuff I needed, that's all I needed. So, it's different for different people. So it is what it is. So anyways, I'll talk to you guys next time. Be aware.